Hey, happy Wednesday. I will say, I hope you're having a fantastic World Mental Health Day. I hope you're having a clear, calm, and mindful day. My name is Chris Bear. I am the producer of Unstuck, an OCD Kids movie. And today, given it's OCD week, I am going to have a quick chat with therapist Natasha Daniels, who has started a page and has a website called Anxious Toddlers. So I'm looking forward to that conversation. If you want to submit some questions, parents, if you're out there and want some questions, that's even better. And I'm going to invite her in, and we'll just do a chat and talk about being a therapist and how that works and all that stuff. Let me, Natasha, I'm adding you right now. Friend request, and then we'll pop on in. Hey, Des.
Yay.
Hey.
That worked.
Yeah, that's great.
I was worried about that.
Yeah, no worries. So thank you so much for coming on. I hope you're having a really good World Mental Health Day and OCD Awareness Week.
Yes, I am. Busy.
Oh, that's good. How do you work it, by the way, with, being a mom and a therapist? Like, are you working 7 days a week at your position, or what? How do you deal with the time?
It is hectic. Thursday, Friday, Saturday, I live in my practice, 12-hour days, and then the 4 days a week, I am burning the midnight oil here late at night, tapping away. So.
Yeah, you're incredibly active, actually. So I want to ask my last question to you first, which was, let's start off by talking about you and a little more information about your programs and where people can find you.
My website is anxioustoddlerstoteens.com. So you can definitely find me there. And my online school, kind of where I help people online, is anxioustoddlers.teachable.com. So, and you can find my podcast, my YouTube videos for kids, all on my website. So it's kind of a good one-stop shop.
Right, and you have a private Facebook group, so you're active on Facebook doing Facebook Lives, lots of podcasts and videos.
Yeah, my private Facebook group is a great group for people who are parenting kids with anxiety or OCD. That's AT Parenting Anxious Kids. They're an amazing group of people. There are over 7,000 of them, and they support each other. Super cool people. I love them because it's a nice group for that size. So that's a lot of extra support.
Oh, that's awesome. And hello, Kristen from Seattle.
Hi,
and
Kristen.
Hello, Lindsay from Texas.
Bobby.
Yeah, Bobby, nice to see you. Thanks for joining. If you want to share this out with people, or if you're involved in any parent groups, feel free to share this so that other people can see this, or even if it's on the replay. We're not going to take tons of amount of time, but I really want to ask from a parent's perspective. I know you can offer a lot of insight, because you not only an OCD therapist, but you also have a child with OCD. So here's my first question. Let's say a child is just diagnosed with OCD. What are 2 or 3 important things the parent should do first?
I think there's 2 that you want to do right away. So you want to educate yourself as soon as you can. Read everything you can. Read good books. Read Talking Back to OCD by John March. That's going to be updated soon, so that will be great when that comes out. I think that's happening in the next few months, hopefully. But there are some good books. So you want to educate yourself, and then you want to find, at the same exact time, you want to find a really good OCD therapist. So I always tell people, go to International OCD Foundation's website to at least start there. Go to iocdf.org/find-help. and at least see what's listed in your area, because you want to get someone who understands OCD.
Right, and has like the specialized training, have you ever been interviewed as a therapist? Has somebody called you and said, I have these 5 questions for you, or sat down and said, I want to consult with you first?
I beat them to the punch, because I won't meet with their kids until I meet with them alone. And so I want people to come in and sit with me and see, do we bond? Do you feel like you can talk to me? Do you feel comfortable? Let me tell you all the things that I'm going to do. Let me tell you what this is going to look like. Does that sound okay to you? So I don't want them to feel rushed. So even if they want to bring their kids to me first, I'll say, I always have to meet parents alone first. just they can, ask me all those questions. Hopefully I answer them before, because I know as a parent, these are the questions I'd want to know.
Put them at ease.
But I have a lot of parents.
Yeah.
They do good research.
Yeah, absolutely. Adam, we'll put the name of the Facebook group in the comments after this, but Natasha, can you tell that like where they can find that group and request to join it?
Yeah, it's called AT Parenting Anxious Kids. So if you go to facebook.com/groups/AT Parenting Anxious Kids, you will find it. It's for kids. It's for parents who are raising kids with anxiety and OCD.
So let me jump to my next question. When it comes to therapy and treatment, what are some suggestions, you just kind of hinted that, to establish that relationship between the parent and the treatment and the therapist?
You want to have a tight bond with your therapist, because you are in the trenches with them for a while, and you really want to feel like you can trust them, but also you want to feel like the therapist is partnering with you. So if you're not feeling that way, you either want to build that, or you want to find someone that you can trust, that you can have that connection with. Because I always tell parents when I work with them, we're a team. We're about to start, and we're going to be a team. So it's me and you and your child. Like, we're all a team. So I think meeting with them alone once in a while can be a really helpful thing, so that you can say, hey, that last exposure or that last episode that didn't work out too well, or hey, I'm trying to communicate at home and it is not working. They're biting my head off. This therapy is for you as much as it is for your kids. I mean, that's what I always tell parents. I'm coaching you, and I'm going to do therapy for your child. It's a twofer. So you want to have that with your therapist.
Right. So if you're a parent out there and you've got a therapist, make sure you're speaking up, right?
Yeah. It's okay to speak up. You're the expert in your child's life. I think a lot of times parents kind of feel nervous because they're like, well, you're the professional. It's like, no, honestly, you know your kid the best. So if you're seeing things I'm not seeing, let me know about it.
Nikki Joe is asking a question that my wife and I were asking a lot this summer, and we're still asking. So, Nikki Joe, I appreciate you asking it. Which is, okay, so you knew how to treat your kid as an adolescent. Now they're a teenager. They're more independent. Any suggestions for kind of making that transition to treating a teen with OCD as opposed to a 9-year-old?
I think it's all about empowerment, and I probably treat little kids the same way I would treat teens, because I know they're teens in training, like that's going to happen. So you really want your teenager to be invested. Like, why do I have to do exposures, or why do I have to work on this? Why is it so important that I stay on top of this? Even if maybe doing a couple of these compulsions doesn't really bother me, and you're annoyed by it, but it doesn't bother me. Getting them to understand the deeper understanding of why it's dangerous, it's bad, you want to work on it no matter what. Because if you don't have a motivated kid or a motivated teenager, they're going to just tell you they're not going to work on it. So I think motivation is key. You really can't move on without motivation.
Yeah, good top. I mean, it's constantly good for us to hear that reminder as well. Love to talk about, so one of the big things that when a parent starts reading about OCD, they realize that there's a term called accommodation, and then like a lot of the instincts that parents have of like trying to help make things better might not be the best thing. So what are some tips? Clearly going cold turkey isn't a good thing. So what are some tactics you would suggest to help parents like wean off the accommodation and get some of their control back?
Yeah, I think a lot of times when parents start reading about OCD, their first reaction is, oh shoot. It's like, oh my goodness, I've been doing a lot of compulsions. I always tell parents, you're the sink, because they won't get OCD, and I'm like, think about it, you're the sink. And they're like, oh, you're right. And then because they feel so guilty, they want to take away the sink right away. And the sink wasn't built in one day, and you can't remove the sink in one day. So I always tell parents, we tackle it just like we would exposures. I have parents write a whole list of what they do. So the child leaves with a list of, these are, I'm going to track my compulsions for a little while, so you can get like a little thermometer read on it. Mm-hmm. But then I tell the parent, track all the compulsions that you do, that you're part of, so that we can rank them. And so we treat it like an exposure. I rank them. If your mom and dad got rid of this accommodation, what number would you be? I'd be a 10. Okay, we're not going to touch that one. How about this one? I'd be a 4. okay, what if we got rid of this one first? And so I try to partner with the child and say, which one can we do first? And I'm very incentive based with my OCD therapy, super effective. And so there's like, it's a game show, there's tickets, and they're cashing in and they're getting prizes. And so they're all in for this. So they want to earn tickets. And so they'll say, well, how much would that be worth if I can get rid of that accommodation? Oh, well, we'll see. Okay, that might be a one ticket accommodation. Okay, I can do it. So my point is, you want to partner with the child. Make a list, pick one at a time, and then slowly go through it. Save the list, because it's very inspiring when you go back to it after a few months and you go, look at all the things that I don't do for you or your OCD anymore,
Right.
which can be really uplifting.
Yeah, I mean, that's important to understand that it's just like everything, it takes time, and you can step down as the kid is stepping up their anxieties. Another question, it deals with schools and teachers play a large role. The kids, sometimes their school can be a huge trigger for them and bring out obsessions and rituals. As a therapist, have you ever got involved in a patient's treatment at school or talked to schools, and then how would you speak to a school and an administration or a teacher?
Yeah, you definitely want to get involved with the school. As a parent, you want to get involved with them right from the get-go. I know with my own son who has OCD, I got involved right away and just let them know what's going on. But I'll write clinical summaries for the people that I see, and I'll list very specific. I'll say, this is their trigger, these are their issues, and then this is what you can do in the school to help. And I'll be very specific. This child's afraid of when people touch their stuff, so you can allow them to have their own personal space. Or this child is triggered by throw up, and so we need to have a plan on how we're going to deal with that. Most of the schools are pretty open. Sometimes you have to get in the States, you have to get a 504 plan, where it's formalized and it's legalized, so that
Right.
they have to do some things to accommodate. But you don't have to. If you have a school that's willing to be educated, that can be very helpful. Sometimes, honestly, I will tell parents, I will send them podcast links. I made a whole podcast just for school administration. And so a lot of times I'll say in my office, I'll be like, here's the podcast link. Maybe they'll be willing to listen to it. And I've had teachers will listen to it, and that can help too.
Yeah, we found that teachers generally want to know, they want to help. I mean, they're in a profession that helps kids, so if they can get something that they can listen to in a half hour that gives them insight, that's even better. Please, I'm going to give you an assignment after this. Please add that link to that podcast, because I think people would like to see that. So here's a question. I'm not sure if we want to answer this or not, but like, somebody's just upped their medication for their daughter. They're not seeing the anxieties and compulsions aren't 100% better after a few months. What's a good time to start thinking maybe you need to change meds or something like that?
Yeah, I don't deal with medication, so I can't really give you any kind of medical advice. But I would say keep in contact with your psychiatrist or whoever's prescribing, and don't be quiet about it. You want to be in contact and say, this isn't working, it's been a few months. Do they need to increase it? And the International OCD Foundation does have recommended dosages, because I know a lot of psychiatrists I've worked with in the past don't realize that you have to have a much higher dose to be therapeutic for OCD. So you definitely want to, I always print that out and I give it to people and I say, here, give this to your psychiatrist, so that they don't get freaked out when they have to go way up. But there are psychiatrists and psychiatric nurse practitioners that are very savvy and very educated on OCD. So you just want to check, make sure you're at a therapeutic dose.
Yeah, Kristen, I'll echo that and saying definitely reach out. It's probably a simple question. Just email or just a quick call to the psychiatrist and say, hey, what time, how long should we give this dosage? I do remember that when my daughter first started going on medicine, the psychiatrist sat us down and said 6 to 8 weeks once she's on full dose. So it took my daughter 2 months to get to the full dose. So it was like 6 to 8 weeks after that. Now we started to see things sooner than that, but that just gave me a mindset to go, oh, okay, if I start on October 10th, I might not see results until December 10th. Okay, good to know.
Yeah.
But definitely reach out to your psychiatrist. Bobby's asking you a question. She's one of your son's patients, so it's a nice And thank you for that comment. We really
Hi, Holly.
appreciate it. Yeah, she is fantastic. Even though we stole one of her friends, Allison, here back in New York. Now, I would love to. My last question is: there are OCD happens to be one of those comorbid issues. So, how do you, let's say, OCD and Tourette's, or my kid has OCD and Asperger's, or OCD and ADHD? How does treatment differ when it comes to, the kid has 2 issues or 3 issues?
Yeah, I think I always tackle OCD no matter what. I mean, OCD is the bigger, better cousin of any of those, typically, and maybe I'm biased because I'm an OCD therapist, but I tackle the OCD. So even like with Tourette's, it depends on the level of tics that are happening. But if we have a high level of OCD as well, we'll tackle the OCD thoughts. Sometimes the stress level will help with the Tourette's because the stress is kind of exasperating the Tourette's. With Asperger's, I change my style a lot because I use a lot of personifying. I use a lot of analogies in my therapy. So I cut back on all that. I'm much more concrete. I don't name the OCD unless it really works for that child. So I'm going to alter my style so that I'm speaking to their needs and what they need for OCD treatment. ADHD, got to make, and medication's not my world, but educating them on, interactions and how that can exacerbate the OCD symptoms depending on what's going on. And also, my OCD treatment might be a little bit more interactive, depending on the child's ADHD issues, because I like to sit them on my couch, and show them my little videos and show them clips, and I write on my TV, through my iPad. And but someone who needs to be bouncing around, I'm going to let them move around. I'm going to maybe get out of my office more. I might do an exposure down in the bathroom, or we might go down to Wendy's or do something where I'm getting them physical. So you would alter it in a different way to kind of address that other diagnostic issue.
And do you generally, work with the child's Tourette's therapist, or whoever's treating the other issue, to kind of like work on a treatment plan? Or I'm just trying to give advice to parents if they have, oh my gosh, we have another issue we got to deal with.
Yeah, I mean, definitely coordinate. I have quite a few people who have multiple therapists because they have, eating disorder therapist, and, they have an OT, and it is nice to coordinate, and it's nice. They'll sign a release, and I can jump on the phone and I can be like, hey, this is what I'm doing. And hey, this is what I'm doing. And so we're not, I have one therapist, we're like not repeating, and so it's kind of like a fine oiled machine. So you definitely want to encourage your therapist to talk with other providers so that there's some coordination.
Fantastic. Well, thank you so much for jumping on with me today.
Sure.
And
Yeah.
this is really illuminating. And thank you, everybody, for your questions. If you happen to be watching this on a replay, keep asking questions, and we will answer it, because it's going to live for a while on Facebook, and I'll throw it on YouTube soon. So thank you so much for joining, and we'll talk to you soon.
All right. Thanks. Bye-bye.